All right, let's talk about something that is quite literally a real pain in the butt, coccydynia. You know, that sharp stabbing sensation right at the very bottom of your spine. If you've ever felt it, you know exactly what I'm talking about. Okay, so let's get right to the heart of it, shall we? For so many people, the pain isn't just this constant dull ache. No, it's that one specific moment, going from sitting down to standing up, that is just the absolute worst. This right here, this quote, basically says it all. This is the classic signature of coccydynia. It's that sharp, focused pain that makes you dread getting out of a chair. You almost brace yourself for it, don't you? So what is going on here? Why does a simple movement you do 100 times a day suddenly feel like someone's jabbing a sharp needle into your tailbone? I promise it's not in your head. There's a very real, very clear mechanical reason for this, and we're about to break it all down. To really get why this hurts so much, we have to start with the anatomy. Now, a lot of us think of the tailbone as, this useless evolutionary leftover, but that could not be more wrong. It actually plays a huge role in how your whole pelvis and core function.
So here's the deal. Your coccyx, those few little bones at the base of your spine, is a super important anchor point. Think of it like a tent peg, holding down two incredibly important muscle groups, your pelvic floor and your gluteus maximus. Yep, the biggest muscle in your butt. And this is where it all clicks. When you go to stand up, your powerful glute muscles have to fire up to lift your body. Well, since they attach directly to the coccyx, that powerful contraction creates this aggressive yank on a bone that's already inflamed and super sensitive. That tug is the sharp, stabbing pain you feel.
Okay, so we get why it hurts when we stand. But what's causing all that inflammation to begin with? Well, it's not always obvious. Let's look at the three biggest culprits.
First up, the obvious one, direct trauma. A nasty fall on the stairs or slipping on ice, a direct hit. Second, childbirth. The coccyx actually has to bend backward to make room, and sometimes it can get sprained in the process. And the third one, which surprises a lot of people, is rapid weight loss. You literally lose the natural fatty cushion that protects your tailbone, leaving it exposed to pressure. But here's the thing, it's not always some big dramatic event. Sometimes the cause is way sneakier. It's a quiet little habit that we do for hours and hours every single day without even thinking about it. Yeah, we're talking about the posture trap. Just look at this comparison. It's so clear. When you're sitting up straight, your weight is on your sit bones, those two bony points in your butt. Your tailbone is actually hovering, totally safe. But the second you slouch, you roll backward off those bones and wham. Your entire upper body weight is balancing on the tiny, sensitive tip of your coccyx. Imagine doing that for hours a day. It's no wonder it gets so irritated. All right, get ready for this because this next part is a game changer. When people have tailbone pain, what's the first thing they grab? Well, what if I told you that common fix is actually making things worse? Let's talk about the great donut pillow myth. I mean, you've seen them everywhere, right? The pillow with the hole in the middle. The logic seems totally solid. Take the pressure off the sore spot. It's the go-to recommendation for any pain back there. Simple enough. Well, for coccydynia specifically, the advice from pelvic health specialists is pretty blunt. Just stop. Using a traditional donut pillow for this kind of pain is a big mistake, and it can actually keep you in that pain cycle for longer. Okay, so here's the why. It's fascinating. That hole in the middle of a donut pillow lets your butt cheeks spread apart. When that happens, it stretches your pelvic floor muscles, the same ones that are already pulling on your irritated tailbone. The real solution is a U-shaped cushion, and the difference is critical. The cutout is at the back. This design supports your thighs and your sit bones, but lets your tailbone literally float in midair with zero pressure and zero pulling.
So if the donut pillow is out, what's the real path to relief? See, the goal isn't just to rest and wait for the pain to fade. The modern way to tackle this is to actually fix the underlying mechanics that are causing the problem in the first place.
A full rehab strategy is about being active. First, and this might sound weird, you learn to relax the pelvic floor with things like deep breathing. This helps stop that constant painful pulling. Then, you build strength in your glutes and core to create a stable support system around your pelvis, which keeps you from slouching. And for some people, a specialized physical therapist can even do some gentle, hands-on work to get the joint moving properly again. And here is a fantastic little trick you can start using today, right now. Before you even think about pushing up from your chair, just lean your chest forward over your thighs.
This tiny move changes the angle of pull from your glutes, making that contraction way less aggressive on your tailbone. It's a small change that makes a massive difference.
And let's wrap up with a pretty cool fact that might change how you think about your tailbone entirely. It's not meant to be totally stiff. A healthy coccyx actually flexes forward a little bit when you sit, acting like a tiny shock absorber. Pain often starts when it gets too stiff or even too mobile, messing up that natural, subtle movement. So it really leaves you with this final thought, doesn't it? We get so focused on that one moment of pain, the act of standing up. But maybe, just maybe, the real secret to standing up without pain has less to do with the standing itself and everything to do with how we spend all those hours sitting down.